other nurse practitioner student from Youngstown State that's going to be assessing you today. How you doing?
Good.
Good. We're going to check your cranial nerves first and then do some muscle checks and deep tendon reflexes. Any issues right now?
No.
Nope. In the past, recently, have you had any muscle issues, inflammation?
No.
No issues? Okay. So first I'm going to check your olfactory nerve 1, which is your sense of smell. So I just want you to cover one nostril and breathe in and out. Just make sure it's clear, and the other nostril. Okay, and then go ahead and close your eyes and cover one nostril and just tell me what you smell.
Peanut butter.
Okay, and go ahead and close your other nostril and close your eyes and tell me what you smell.
Coffee.
Good job. Thank you. Okay, and then I'm going to check your optic nerve. We're going to do that with the Snellen eye chart. Just go ahead and cover one eye 6 feet away and read this line for me that I'm pointing to.
E P T Z O.
Okay, and then cover your other eye.
O Z T P E.
Perfect. Thank you. And then confrontation. This is, I would be at the same level as you and cover one eye, cover your right eye, and I'll cover my left eye. And you just tell me what you see.
2, 1, 3.
Okay, and then cover the other eye.
2, 1, 3.
Okay, good job. Thank you. And then I'm going to check your nerves 3, 4, and 6, oculomotor, trochlear, and abducens with more vision checks. Your cardinal fields of vision, your accommodation, and your reactivity of your pupils, okay? So I just want you to kind of look over my shoulder, and we'll, I don't really want to shut the lights off. Put it this way. Dim the lights. Okay, go ahead and look over my shoulder, the closet there, and then just follow this pen light as it comes close to you, okay? Okay, good job. Pupils constrict and follow. You go kind of cross-eyed. Okay, and then I just want you to follow this pen light and don't move your head. This is the 6 fields of vision. Okay, good job. Thank you. You can flip the lights back on. And then I'm going to check your 5th nerve, the trigeminal. This is your jaw and facial strength. So I just want you to clench your jaw and feel that muscle contracting equally, bilaterally. And then I want you to open your jaw against resistance. Yep, good job. And I want you to say, ah. So look at your, yep. Glottis is reactive, so good gag reflex. And that's your vagus nerve, 10. And then I'm going to check your acoustic. I did this a few weeks ago. We'll do it again just in case you have any hearing loss. So the Weber, Ryan, and whisper tests, okay? So go ahead and plug this left ear, and then you tell me what you hear me say, okay?
Apple pie.
Good job, and plug the other ear. Thank you.
Popcorn.
Good job. Okay, and then this is the Weber test. You should hear this in both ears equally. If one ear is louder than the other, or you don't hear it at all in one, please let me know, okay? Just right on the forehead. Do you hear that in both ears?
I didn't hear it at all.
Oh.
I hear it.
Both ears equally?
Yeah.
Okay, good deal. And then this one, you're going to tell me when you don't hear it anymore.
I don't hear it.
And when you don't hear it anymore.
Don't hear it.
Okay.
Don't hear it. Don't hear it.
Okay, good deal. Should be twice as long. as air conduction. And then I'm gonna check your vagus, which I already did, your ability to swallow, your speech is clear and intact, there's no issues there. And your spinal accessory nerve, your ability to shrug and rotate your head. So just shrug both shoulders for me. Thank you. And then rotate your head one side to the other. Perfect. Good. Any pain with that or any? No? Okay. And then I'm going to check your deep tendon reflexes. So let's try to just keep your arm nice and relaxed for me. And this is your biceps tendon. Good job. 2+, and we'll check the other. Just kind of relax. Okay, 2+, good. And then just relax. Yep. Triceps. Good job. Triceps on the other side. Just try to relax. I know it's hard. Good job. Okay. And then your brachioradialis. Good job. 2+. And check bilaterally for them to be equal. Good job. 2+. And then your patellar, just try to sit back a little bit more on the bed there for me. So your legs are just kind of relaxed. Just relax your legs. This is patellar. Good job. That one was really good. Okay. And your Achilles tendon, I'm just going to kind of hang on to your pinky toe here. Just nice and relaxed. You have your foot flexed. There you go. Good. And then I'm going to check your superficial reflexes, Levinsky. Yep. Good job. Those are negative. And then the abdominal reflexes we checked last week, and that was negative. So I'm going to check some of your cerebral functioning, your ability to kind of ambulate, and your gait and how steady you are, and do you ever have any issues with falling, tripping up, or your balance or anything? Nope. Okay. So first, while you're still seated, I just want you to take your heel, I don't have very good balance, and run your heel of the opposite. Just kind of do what I do. Up to your knee and back down. Go ahead and do that. Nope, seated, please. Yep. Good job. And then go ahead and switch to the other side. Perfect. Okay. So I'm going to have you stand up and just walk to that exercise bike heel to toe. Perfect. And then just walk around the perimeter of this road, just normal. Great. And then if you can go ahead and walk backwards to the bed and sit down. Perfect. And then I'm going to have you go ahead and look straight on at me. Touch your nose for me. And I want you to touch my finger wherever it is, and then back to your nose. Go ahead and touch my finger and touch your nose. Touch my finger, your nose, finger, nose. Perfect. Okay. Any issues with completing any of those? I felt like you did pretty well. And then we're going to do the Romberg test. You're going to stand up and cross your arms. Just kind of copy what I do. And we'll stand here for 30 seconds. Okay, we'll pretend that was 30 seconds. And then I want you to close your eyes and stand here for 30 seconds again. And we're just looking for any swaying. Your gait, you're nice and steady. You don't seem to have any balance issues. Perfect. Go ahead and sit down. And then I just have a couple objects, and I'm just going to ask you, I'm going to put them on different areas, and you're just going to tell me if it's sharp or dull, okay? Go ahead and close your eyes.
Sharp. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. 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 Dull. Dull. Sharp. Dull. 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 Sharp. Sharp. Dull.
Okay, thank you. Okay, and then we're going to bend that down twice. With your eyes closed, I just want you to tell me if I'm touching you with two objects or one object, okay? So go ahead and close your eyes.
One.
Two or one object?
One.
Two or one?
Two.
Two or one?
One. Two. One. Two. One. Two. Two. One. One.
Okay, thank you. Okay, and I'm just gonna move your extremities here, and you're gonna tell me if I'm moving them up or if I'm moving them down. This is perception. So go ahead and close your eyes and tell me if I'm bringing your finger up or down.
Down. Up.
Okay. Up or down?
Down. Up. Up. Down.
Okay, perfect. And then I'm going to put some objects in your hands with your eyes closed, and I just want you to tell me what these are. We'll go ahead and put your right hand out.
Key.
Okay. And your left hand.
Paperclip.
Okay, thank you. Okay, one thing I missed was muscle clonus. So I'm just going to kind of wiggle your foot and just relax your foot for me. And then I'm gonna flex your foot and then let it go and watch for a reaction. There should not be any. Yep, good deal, perfect. Okay, and then we're just gonna move on to musculoskeletal. And you said no issues, no joint issues,
Nope.
no pain anywhere. Okay, so we're just gonna go through head to toe. We'll start with your hands and wrists. Can you just put both hands out in front of you? I'm just gonna feel for temperature, looking for any masses, palpating the fingers. You let me know too if you feel any pain when I touch anywhere, okay? Any pain?
None.
No. Can you kind of squeeze my fingers and pull back a little bit? Perfect. And I want you to push up against my hands. Perfect. And push down. Good. Okay. And I want you to just kind of copy what I do. Go ahead and, yep, flex, extend, bring your fingers together, apart, supinate, pronate, yep. And then we'll move on to your wrists. Go ahead and bend your wrists down and then up and just rotate them. Perfect. No pain, no crepitus when you're doing that. I don't feel anything. You've never had any broken bones?
No.
Okay. And then your elbow, any pain?
Nope.
Nope. Can you push down on my hand? Good. And pull up? Good. This feels good. Okay. Let me check the other one. Go ahead and pull up and push down. Perfect. Okay. Go ahead and bring your elbows all the way up, back down. Any pain?
No.
Okay. Perfect. And then your shoulders. Why don't you just go ahead and stand up? Well, you're fine seated. Go ahead and shrug your shoulders for me. Yep. Okay. Any pain? I'm going to palpate the joints. Any pain?
None.
Nope. No crepitus. Nothing when we're moving them.
Nope.
Nope. Okay. can you go ahead and forward flex? Go ahead and reach up overhead. You might want to stand up for this because I think your hands are going to hit the bed. And then reach down back behind you. Any pain in your shoulders when you do that? Nope.
No.
Okay, and shoulders, arms at your side, and just take one arm out straight, and then bring it across you. Yep. And back down. And then take it back like you're scratching your back. Yep, and then go up the other way, like you're scratching the bottom. Okay, and then we're going to do the same thing with the other arm. Straight out, and then adduct, abduct, up, back to your upper back, scratch, and around the other way. Any pain with anything? Nope, you seem equal movements, muscle mass seems good. Okay, go ahead and turn around for me. Well, let's turn this way. So I'm just going to check your C-spine, thoracic, and lumbar. You have a nice S-curve to it. I don't see any concerns, palpating, everything feels equal. Any pain when I touch anywhere?
Nope.
Nope. Scapula, everything seems good. Go ahead and rotate in a big circle your neck. Feeling for any crepitus as he does that? Any? Nope, everything seems good. And then I want you to go ahead and raise your shoulders up. Go ahead and lean forward, down and touch your toes. And I'm looking for like any scoliosis, any ribs that kind of stick out when he does that, any bulges. Everything looks good. Go ahead and stand up. And then I want you to lean back. Any pain with that?
No.
No? Okay. Forward. And then go ahead and lean to the side, to the left, and to the right. And then rotate. You can turn towards me. Rotate this way, that way. Yep, good deal. Okay. And then we're going to check your hips, okay? Any pain with your hips? Nope. So just raise up one, raise up the other. And then I want you to rotate in, just kind of copy what I do, and then back out. And then the other leg, rotate in, rotate out. Good job. Okay. And then I want you to go ahead and step away from the bed a little bit. And then the outside hip, go ahead and bring it out. And then cross it over, adduct, yep, and out, abduct. And do the same with the other. And then adduct over. Yeah, good balance. Everything seems good. No pain with anything?
No.
Okay. Go ahead and have a seat. And I want you to bring up, go ahead and, let me see here, scoot back a little bit. And bring your leg up against my hand. Yep, raise up. Good. And then do the other one. Perfect. Okay. Any pain? No? Okay. Any knee pain? No? Can you just raise one up and raise the other one up? Yep. Any cracking when you do that? Anything? Nope. Feels good. Okay, and how about your ankles? Can you roll? Bring your toes up like to your knees. Yep. Go ahead and stand up for me. Stand up on your tiptoes. Good. And then go back on your heels. Perfect. Okay, go ahead and have a seat. And then I'm going to have you go ahead and lay on your stomach. And I want you to bring this leg up against resistance. Yep, good. And go ahead and put it down. And then bring it up. Bend at your knee. Good. And then the opposite leg. Bring the whole leg up from your hip. Yep. And then put your knee down and bring your lower leg up against resistance. Yep, perfect. Okay, you can go ahead and roll back over. Okay, Nathan, thanks for coming in today, and we will see you next visit. Do you have any questions before you go?
Done.
Nope.